Okay, guys, now we will be discussing that how over the last 2 decades, the North American dental license exams, they've been changed and what challenges they are giving us in this time post-COVID era and how we have to tackle with it. What services as the mentor, as the trainer, as the guide I can provide you, and what you have to do yourself to tackle with this situation. Well, the goal of this lecture is how to improve the performance of one aspirant in the examination, how to prepare for the exam, strategically analyze the MCQs, prepare for the exams, and controlling your emotions, don't panic, etc. etc. Definitely, all these steps will improve your performance for the exam. As I told you that before pandemic, the situation was different, but post pandemic or post COVID, new challenges are there. There were delay in assessment and approval of documents by NDEP, which definitely causes frustration. Exams were postponed and impact is still seen as seats are very difficult to get. Limited capacity of examination centers, cancellation of exam in February 2020, and voiding the results of December 2020 exam by NDEP that also affected the whole system. Assessment of Fundamental Knowledge exam or AFK exam. The post-COVID new challenges. Social distancing was introduced, and because of that, the capacity of the exams, it was not completely filled. Masks, they were became mandatory, and the person required to reach to the exam quite early so that they had to go through all the procedures, and then they were being seated at the appropriate station, and etc etc. Previously, these exams were being conducted in the convention centers in various cities or even in the universities halls in various cities. But then they contacted a third party which is known for conducting these types of exams, including the INBDE exam as well as TOEFL exam, and the company is known as Prometric. Also, this company offers dental exams in the Middle East as well. Well, when you reach to the Prometric Center, you are required to keep all your belongings inside one locker, including your cell phone and your watch. You are not allowed to wear your watch inside the examination center. And then you are provided with a lock and key, and the key it has tags. Those tags are color coded. And what are the meanings of those tags? Red means no access, yellow, access to food, liquid, medicine only. Green, you have full access during the exam to the uh, belongings, and blue, you need to follow whatever the instructions provided by the administrator of your Prometric center. Usually in our exam, they give us red tag. You are not allowed to access your locker during the exam. But if someone gets permission from the NDEP that they have some problem, like especially cardiac patients or hypertension patients or diabetics, they need to take the food as well as their medicine, etc., etc. So but definitely it should be approved by the NDEB in the beginning, and then you will be given the yellow tag. Depending on it is again case to case. This is the situation inside the Prometric center. Every center, it has their own computer, their own processing unit, and then there is one headphone one mic, as well as this type of headphone, which is basically doesn't let any voice reach your ears. You don't know you are appearing in your AFK exam or in your ACG exam over here, and the person sitting next to you would be appearing for some other exam, like maybe TOEFL, and one of the requirements of their exam is to speak. So when they will be speaking, you may get distracted. That is why it is always necessary to, if you feel that your person sitting next to you is speaking, you can use these type of headphones. Well, this is the situation inside the Prometric Center. Well, now question arises that how to study for this exam. The study tips are: always pre-read the text when you start a topic. Attend the classes, take the notes, ask the questions from instructor, review and edit your notes on the same day when you attend the lecture. No matter it is recorded lecture or it is in-class lecture or it is a discussion session. Then, going through your notes, ask yourself questions. Question could be modified in your mind. If you can modify the questions and you can ask yourself questions, then your ability to answer any stupid question, any tedious question, it is going to be improved. Because in exam, you will find some of the questions which you have never seen or never experienced. But this quality will definitely make you better to perform in your exam. Always outline the major topics of one subject. It is very difficult to master with all these. So you are not going to do your PhD in one topic or one subject. You have to pass this exam. Your only and only goal is to pass the exam with more than 75 percentile. That's it. Read the text selectively. There are over 100 books which are given in the list of you can say recommended literature or recommended textbooks on the website of NDB. Practically, it is impossible to go through each and every single textbook and retain that. Maybe you will take 3 to 4 years to prepare for the exam if you will do that. Over the years, this exam, it has been transformed from factual knowledge exam to the critical thinking exam. Well, in the factual knowledge exam, you memorize the information and definition. The answers are straightforward. Knowledge from the textbook is sufficient to solve the exam or solve the questions. Most of the questions are made up by breaking the factual knowledge into two parts, and the second part of the sentence will be the answer. Other options will be just distorted informations or distractors. Well, knowledge we have, like say for instance, there are two types of local anesthesia, the esters and amides. And we have memorized the names, and for our ease, we have also kept in our mind that when there will be a single I in the name, it will be an ester. And when there will be two I's in the name, it will be an amide. And then if we get the factual knowledge question like this, lidocaine is an example of a local anesthetic which is chemically classified as, we know that it is amide. It is not an ester because lidocaine has two I's in it. Time save trick. Critical thinking exam. In this exam, only memorizing information and definitions is not the key. A good critical thinking test will engage you in using your critical thinking, because critical thinking is a process. Achieving greater success with critical thinking requires appropriate knowledge and its utilization in certain situations. Having adequate knowledge and interpreting it to apply at that certain scenario is the key. And that comes with practice. Now, look at this question. A 7-year-old patient is missing tooth 5.5 and tooth 7.5. Space maintainers were not placed. A current mixed dentition analysis yields the following data. Means on the right side, in maxilla, the space loss is 5 millimeter. On the left side it is 3 millimeter. Well, on the right side in mandible, it is 3 millimeter, and on the left side, it is 4.5 millimeter. So where the teeth were missing, the space loss is greater. 2 millimeter extra on the right side and 1.5 millimeter extra on the mandible. Looking at it and interpreting this whole table over here and knowing, like basing on the knowledge which we know from our study, that what is the leeway space, etc., etc. So the actual space loss, assuming there was no asymmetry in the tooth size, is 8 millimeter in the maxilla, 2 millimeter in the maxilla, 7.5 millimeter in the mandible, or 4.5 millimeter in the mandible. Answer will be 2 millimeter, because where the tooth was present till the end, it was 3 millimeter space loss. Additional space loss is 2 millimeters. So 2 millimeter extra in the maxilla. That is the answer. But if they will ask the same question for the mandible, it will be 1.5 millimeter in the mandible. They can change the question. Well, paper exam could be paper-based as well. And in that, you will be getting your, what do you call it, the question booklet, and then the answer sheet. This will be the type of answer sheet you will get. Keep in mind that it will be processed using a computer scanner, and then your result will be processed with the computer software. No human would be involved. So do not expect any mercy. And this is even the most difficult way of giving the exam. You have to be very, very careful, like your name. Then say, for instance, your ID number. So you have to firstly write your ID number. Say, for instance, your ID number is 13531. So what you will do, you will be darkening the 1, then you will be darkening the 3, then you will, sorry, this is not 1, this is 1, this is 0. And then you will be darkening 5 over here, then 3 again, and then you will be darkening 2 over here. So like this, you will be doing it. But you have to be very, very careful. If you are not doing it properly, maybe your attempt is going to be wasted, because computer will read it wrongly. Same for your like the spellings of your name. You will be writing your name over here, and then you have to do this darkening over here. Remember this thing. And then the answers of the questions. You will be darkening the answer. If you have any doubt, then don't darken it too like darkly. If you will do that, then even if you will erase it, maybe computer is going to read that answer. And like, say, for instance, your first instinct was saying B, but then you say, no, 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 it could be C. You erase it and you darken it. Maybe computer is going to read both of them, and your answer is going to get a 0. Though you have answered correctly, but you will get a 0. So you have to be very, very careful if you are going for the paper-based exam. Just remember that thing. If you are not sure about your answer, don't make it too dark so you can erase it easily. That is the tip. Time management in your paper-based exam is also important, because computer-based exam, you won't be able to go into your exam once the time is over. Computer will kick you out of the exam. Many people, they got into trouble with the paper-based exam actually. Manage your time in such a way, and that is what we do in our tests, that we ask you to manage the time before the actual expiry time. We train you on the weekly basis so that you will be trained to finish your exam before time, at least 5 minutes before the time, even after rechecking your answers. Because if you would be even holding the pencil or even the eraser in your hand or anything like that, or you are looking into the examination paper or on your answer sheet, you will be disqualified after the time is over. Once they say stop writing, don't touch your pencils or erasers or anything, don't do it. Leave everything on the desk and stay away. Don't touch at all. I know at least 3 cases who got disqualified because of touching their papers or holding the pencil in their hand after the time is over. Remember that. And those people over there, the invigilators, they are just like robots. No mercy at all. They will make the case will go to the NDEB, and NDEB definitely rely on the report provided by the invigilator. Remember this thing. MCQs are tricky. Why? Most commonly used objective test questions. They consist of 2 parts, the stem or statement or question, and then answer choices, which are known as distractors or foils. MCQs, they assess your memory of facts, details, and or relationship, the ability to reason. Those type of MCQs are known as K-type questions. They require integration of knowledge and decision making. So you synthesize your knowledge, analyze it, and apply to answer. 2 rules to remember when taking MCQs: budget the time wisely, which I just told you, relax and don't panic. Multiple choice K-type questions. A student suffers an injured ankle while running to first base in a softball game. The teacher examines the indicated area. The symptoms are typical of a sprained ankle, although the injury may in fact be more severe. Which of the following steps should be included in the first aid administered to the student? Elevate the injured leg, apply ice to the injured area, apply direct pressure to the site of the injury. So 1 only, 2 only, 1 and 2 only, 1 and 3 only. We will go for 1 and 2 only. Step 1 is read the stem carefully and identify keywords in the question stem. Step 2, you might ask yourself, if the injury is more severe, then what other conditions could apply? Step 3, although the stem implies that the injury may be more serious, it is not definitely stated. Therefore, the first aid administered should be based on a sprained ankle. That's it. So 1 and 2 only. Anatomy of an MCQ item. There is a stem, there is a lead-in, and then the options. 1 correct answer, rest are all distractors. Stem. Usually it is the clinical scenario, generally clear and unambiguous, ideally longer relative to options, includes all pertinent information, patient's age and gender, clinical setting, complaint, other important information like history, physical findings, and the test results. So this is the stem. Lead in, it follows the stem in the form of a question, should relate to the stem, should be answerable without looking at options, cover the options test, should clearly communicate the learning objective. Distractors. There will be 3 to 4 choices, which could be either common misconceptions or faulty reasoning. Each should be selected by some, therefore all plausible, none obviously incorrect. Well, say for instance, they give you a question that a patient whose third molar been extracted surgically, and you have prescribed them some antibiotic. Patient calls you the next morning and says that they are having cramps in their stomach and they have watery diarrhea. What they should do? So, misconception, ask them, you have started the antibiotic, you have to finish it for 7 days, no matter what. Second misconception, well, take it with milk or with buttermilk. Third misconception, start using some probiotics. Fourth, stop the medicine. Immediately come to the dental office, we will give you another antibiotic. Or go to your pharmacist, we will call them and tell them to give you another antibiotic, whatever. So, distractors are mostly common misconceptions or any faulty reasoning. A well-written MCQ will be clearly worded and avoid giving clues to the best answer. Types of MCQs, true or false family, assess recall of the isolated facts. Generally, they don't appear in your exam. Usually, they have subtle flaws. Example of true-false questions when managing patient with true latex allergies, which of the following statements is true? The sterilization process effectively removes latex proteins from instruments handled with latex gloves. Misconception. Latex protein antigens can exist in the ambient air for a maximum of 10 minutes following operative procedure. Faulty. Emergency kits should be available that contain latex-free material because in emergency, you never know that the patient would be unconscious because after a road traffic accident, the patient is coming. Or the tooth is avulsed and you have only few minutes left before you have to replant it, whatever. So emergency kits should not be having any latex material. They should be having latex-free material. This is the actual answer. Patients should be scheduled at the end of the day to avoid any exposure to, this is again a wrong reason. Then all true except type questions. All of the following are possible effects of acetyl salicylic acid except. We know that it is an antipyretic, so reducing fever. But we know that aspirin is being used for thinning of the blood. How? By increasing the bleeding time. And how? By affecting the platelets. So this is the wrong one, except. Suppression of inflammatory response. It is being an NSAID, it definitely suppresses the inflammatory response. Bleeding from the GIT. Yes, it is a known problem by all the NSAIDs and specifically by aspirin that it may cause GIT bleeding. So all these are correct except C. Oh, sorry, except B, shortening of the bleeding time. Well, certain questions which probably would be new, and when you will come back to me after your exam, maybe I will take some time to answer those because they could be based on some new research. Such type of questions are known as pilot questions. Those pilot questions usually in some of the exams, they are not being marked and they are placed experimentally to see how the aspirants they are answering or responding to that question. Well, over there, the process of elimination is the most effective way to improve your chances of selecting a correct answer. Eliminating incorrect answers, details are important. Watch the subtle differences in answers choices. Use question stem to find the key text. Answer choices must be logical. If reasoning for answer choice is not correct, then answer is not correct. Incorrect answers, they misrepresent facts or fact. Ignore the central issue in the question and have faulty reasoning. So you have to keep these things in your mind when you will be answering. And correct answers, they state the fact or facts, address the central issue in the question, and they have sound reasoning. Well, some of the MCQs are of this type where there will be multiple correct answers. You have to choose one most correct one. Which of the following describes the position of the needle tip during administration of local anesthetic for the inferior alveolar nerve block, anterior to the pterygomandibular raphe, medial to the medial pterygoid muscle, superior to the lateral pterygoid muscle, lateral to the sphenomandibular ligament? We should be familiar with the anatomy. We should be knowing where the needle is going. This is the sphenomandibular ligament. And over here in the mandibular foramen, our inferior alveolar nerve and vessel and all that, they are going. So this is the medial side, this is the lateral side. We are lateral to the sphenomandibular ligament or medial pterygoid muscle. Types of MCQs, multiple response right answer type or multiple statements will be correct, and you have to choose the best combination. Well, this type of question in AFK, you are not getting this type of question. But in American exam, you may get this type of a question where you have to look into multiple answers and then the combination will be the answer. Like, which of the following affects polymerization of visible light cured composite resin, intensity of the light source, thickness of composite resin, proximity of light source, shade of composite resin. So basically, if we look at all of these, all of the above are correct. In AFK, this type of question could be asked in this way. Why, like, where they will give you all the correct answer and then D, all of the above type. While the teeth are set in wax, dentures are tried in to verify the maxillomandibular records, verify the vertical dimension of occlusion to evaluate the aesthetics. So answer is all of the above. Why these MCQs, they are so challenging? Many students believe MCQs are more challenging than essay or short answer questions for these reasons. MCQs tend to test for detail. If you are not a detail oriented person, you may find these types of questions more difficult. You can justify your answer in an essay type question, but you cannot argue or justify your answer in the MCQ. Whatever the key is available, you will be assessed accordingly. Many questions, like so many questions are there, it could be overwhelming to few people. Even though MCQs tend to be worth less than an essay question, some students prefer having fewer questions to focus on. Myths about MCQs. Numerous myths circulate about how to perform well on the MCQs. Pick the longest answer. This is simply not true. More often, the key will be very complete yet concise. When in doubt, pick C. No, there is no evidence to support this advice. Test writers are advised to vary the location of correct alternatives randomly. Never change your first answer. If you have solid, rational arguments for changing your initial answer, then do so. Otherwise, trust your first instinct. Guessing. Guessing game is not a very good idea. If there is no negative marking for incorrect answers, guessing could be fine, but relying on guessing alone is a risky venture. Consider this odds. If you take a 25 questions multiple choice test with each question containing 4 choices, you have almost a 1 in a million chance of getting a C or higher with guessing alone. C means the C grade. Preparation strategy. Know the details. MCQs tend to test for detail. You must study the material thoroughly and aim for understanding, not just memorizing. Process the material deeply. Cramming will not aid this process. Many people fail this exam because they just rely on answers and they get the answers from like without looking into the reason why this answer, they just memorize the answer and they think that they would be good, but that is not the correct thing. Practice, practice, practice. And for that, you have to take all the tests. Reading over your notes and textbook is simply not enough. You must practice what you will be doing on the test. If your exam is clinical scenario based, spend the majority of your time solving these type of questions. Be familiar with the types of MCQs used in your exam. As I told you, in AFK, you are not going to get this type of questions, but you will get this type of questions. But in American boards, you may get this type of questions where you have to answer a combination of the correct answers. Now, INBDE exam and its structure. This exam is replacing the old NBDE Part 1 and Part 2 exams. This is one exam which is extended over 2 days. There are 360 MCQs items and you must attempt all the items. Day 1 exam is in parts, breaks between the parts. And it is advised to take the breaks so that your neurons are going to get replenished. Well, Firstly, you will be getting a tutorial for 15 minutes. I always advise that you should go for it. Section 1, 100 standalone items, 105 minutes. A scheduled break for 15 minutes. Then section 2, 100 standalone items for 105 minutes. A scheduled break optional for 30 minutes. Take it. Section 3, 100 standalone items, 105 minutes. Then a scheduled break 3, optional for 15 minutes. Section 4, 60 items, case-based, 105 minutes. So total day one time is 8 hours, 15 minutes. MCQ items are comprised of basic and clinical sciences. Basic sciences questions are not too deep or difficult, usually on different body systems. Well, clinical sciences, they are of different types: direct knowledge-based type, critical thinking type MCQs with case scenarios in the stem of the question, case scenario questions with case history with or without a picture. These pictures could be pathology or a clinical situation or an X-ray. MCQs on pictures with a pathological lesion or an X-ray only. Day 2 questions, there are 140 questions on day 2. There will be a break during the exam. The exam will be of the same pattern as day 2 of the NBD part 2, which they used to conduct. There are cases with complete synopsis, pictures, dental chart, medical history, social history, and chief complaint. There will be 8 to 12 questions per case, and those who will be showing intention that we are going for INBD part 2, I will definitely guide them for their part 2, and I will take extra lectures for them for their day 2 exam. So day 2 tutorial, again, always take the tutorial. Section 5, 70 items cases, 105 minutes. Schedule break 15. Section 6, 70 items again cases, 105 minutes. Post-exam survey, that is optional. It is better to give them a feedback, 4 hours, 15 minutes. Services by the Prometric for INBD test takers. Tutorial: at the beginning of the test administration session, candidates will be given an opportunity to take a brief tutorial before attempting official test questions. The tutorial is designed to familiarize candidates with how to use the test administration computer to navigate the exam. Test drive. Prometric offers a test drive to allow candidates to become familiar with the testing experience. In 30 minutes, candidates can preview what they will encounter during their official test administration session, including the scheduling and registration process, the complete check-in process, introduction to test center staff and surroundings, a live 15-minute sample test. It could be a generic test. It is not the INBD type test. To experience the testing process, visit Prometric at prometric.com/test drive for further details and pricing. Advanced Dental Admission Test, ADAT examiner. ADAT is an admission test designed to provide advanced dental education programs with a means to assess an applicant's potential for success in these programs. The ADAT is used by advanced dental education's programs in conjunction with other admission tools that provide insight into candidate qualifications as they relate to core program requirements. Examination specifications. The ADAT is composed of multiple choice test questions presented in the English language. Just a minute, guys. So I was telling you about the examination specifications. The ADAT is composed of multiple choice test questions presented in the English language. Both the US customary system and metric system, imperial system, international system of measurements are used in the ADAT. The ADAT consists of these sections: biomedical, clinical sciences, and data research interpretation, and evidence-based dentistry, which I mentioned earlier in the previous lecture as well. Biomedical sciences, 80 items. So what is the breakup? Anatomic sciences, 20 items. Biochemistry and physiology, 20 items. Microbiology and pathology, 20 items. Dental anatomy and occlusion, 20 items. Clinical sciences, 80 standalone and case-based items. Data, research, interpretation, and evidence-based dentistry, 40 items. This exam is conducted at another third-party exam taker, Pearson VUE Test Center. Just like Prometric, There is another company which provides the center for various exams, and its name is Pearson VUE Authorized Test Center. Well, ADET administration, it is from 2022, but same thing is happening even in 2025. Tutorial, 15 minutes. Biomedical sciences, you will get 95 minutes for 80 items, then break, 10 minutes. Always take the breaks because your neurons, they need to get revived. Clinical science, 80 items, 90 minutes. Break, optional, 10 minutes. Data, research, interpretation, and evidence-based dentistry, 40 items, just 45 minutes. Post-test survey, optional, 5 minutes. This is like, I'm telling you, 4 hours, 30 minutes. So if you are not taking the breaks, you can finish but what you are going to gain in your life in like 30 minutes? Better to take the breaks. And yes, take the tutorial as well as post-test survey to give them a feedback. That is good for you. Scoring of the exam. ADET scores are calculated based on responses provided by the candidates in conjunction with the known characteristics of administered questions. Question difficulty levels. Candidates are not penalized for guessing. The ADET program employs, penalized for guessing means no negative marking. The ADET program employs sophisticated psychometric procedures to accurately and fairly evaluate candidate skills. ADET results are reported as scale scores. They are not actual scores. They are scale scores. These scale scores are not raw scores, as I just told you. The number of questions answered correctly. Using scale scores, it is possible to meaningfully compare the performance of one candidate with the performance of all the candidates. Scores used in the testing program range from 200 to 800. Minimum is 200. No matter what you do in the exam, you will be getting 200. And best score is 800. Well, if you want to aim for a dental school, your aim should be more than 600 marks. The ADET program does not establish formal passing or failing scopes. Google may or may not help, so it is better not to rely on Google or on AI for your answers. How is the preparation going to be changed? Apart from the preparing for the exam, we should get acclimatized to solve the exam on computers and on internet-based protocol. Even study on computers. Forget about the hard notes because it is better that you get acclimatized to the computer if you are going for ADET, INBDE, and computer-based AFK. We need to solve as many tests as possible. Timing yourself to solve the exam is very important. Like if I give you 30 minutes, it is better to finish your exam in 25 minutes. Our support, making internet-based tests and mocks, hired a software company to design a software for online tests and mocks. Our support is available. New challenges are there, and we are here to face all the challenges with you. Successfully, we are running this show for over years and years now, more than 2 decades now. Teething problems are there in the beginning when you start the new program, but no frustrations. And my support will be there 24/7 to all of you. This is how your online tests will be, and you will be getting the time as well as how many questions you have answered. And then finally, when you will be done, your result will be presented to you. You can email your result to yourself and you can review the answers, the correct answers. Your satisfaction is my satisfaction. You are in safe hands. This should be our belief, and together we will do it. New form from this session. In this academic session, we are providing our students with an environment where during the prescribed period, they will watch and listen to the recorded lectures in their own convenient time, which will be uploaded subject-wise. Like say, for instance, in the beginning, we will be uploading dental materials and prosthodontics. Prosthodontics and dental materials, they are 2 subjects and they are quite long subjects. So we will take 10 days. Every day, 2 or 3 lectures will be uploaded and you are required to watch those. And then after that, you will be given an opportunity while watching those. You will be posting in, there is a Facebook group where you will be all together and you will be asked to post your queries and questions on the wall of that group. Over there, we are going to collect your queries and questions for our online discussion session. Fridays, you will be getting test on the subject we have finished. It is not going to be very difficult test, but it will tell us that you have studied and you have gone through the lectures. It is not going to be very difficult, but definitely it will assess that, definitely it will show us that you have gone through the uh, all the videos which have been uploaded. Then on Saturdays, we will be having live session. We will be discussing some very important questions. We will be discussing some very questions and their answers and their rationale. We will be discussing also the questions which have been provided to you in the test, their answers and the rationale, and your queries and your questions and all those, they will be also addressed. So it will be like 3 to 4 hour session on Saturday. We will start at 11 a.m. Eastern Time. It will help us in realizing how much more help is required by a particular student so that we can give them some individual care as well. So over here, it is done and we are open for your questions now. If any questions, you can always type it and I will answer it.